gastroesophageal reflux disease, peptic ulcer disease, stress-related mucosal injury. I get heartburn just thinking about it. The pain associated with all of these conditions occurs when that gastric acid and pepsin starts to erode mucosa that's normally protected by a shiny barrier of cryoprotective mucus. Well, the following drugs protect against this pain by decreasing acid production. Think back to that Sketchy micro Helicobacter helicopter sketch, and remember that H. pylori thrives in that acidic environment and can promote ulcer formation. And reminisce for a bit about the fun times at the NSAID baseball diamond, where excessive COX inhibition led to some adverse gastric erosion. Yep, blocking acid can be pretty handy. So just relax and enjoy a refreshing glass of citric acid as a few young enterprising kids at the local lemonade stand demonstrate the difficulty of managing a startup in the acid production business. This scene of gastric acid secretion centers around the parietal cells of the gastric mucosa. These cells are located in the fundus and body of the stomach, where they secrete acid directly into the lumen. So, before we hit up this charming lemonade stand for some refreshing citric acid secretions, I want you to notice the catchy name of this little establishment. In today's fast-paced, prepubescent world of lemonade stand startups, you can't just sell lemonade anymore. You've gotta have a brand. Pour it all lemonade. Ingenious. I want to meet their marketing guy. Acid is secreted across the apical membrane of the parietal cell via the hydrogen-potassium ATPase proton pump. Similarly, on the apical side of this lemonade stand, there is a puree pump, and it looks like Braden's mom here thinks they can spice up the menu to stay competitive in the local lemonade scene. She places a potassium-enriched banana into the puree pump while acidic lemons fall into the sidewalk below. Think of the sidewalk as the acidic lumen of the stomach. This exchange of a banana for a lemon should remind you of the exchange of one potassium ion into the cell for one hydrogen ion out into the lumen. Also, notice the 3P batteries powering the juicer, our recurring Sketchy symbol for a process driven by ATP. There are a few signaling molecules that activate the parietal cell to produce acid. Let's first talk about histamine, which at Sketchy is always symbolized by some allergy-inducing bees. In this scene, however, they will not be acting on H1 receptors to induce allergic inflammation. Instead, we'll focus on the H2 receptors at the basolateral membrane of the parietal cell. Just like in the Midsummer Night's antihistamine sketch, the H2 receptor is symbolized by a bee-infested honeypot with two S-shaped handles, to remind us that H2 is coupled to G sub S. Thus, when histamine binds the H2 receptor, it activates adenylyl cyclase, which increases intracellular cyclic AMP to activate protein kinases responsible for turning on that hydrogen-potassium ATPase proton pump. And now you've got acid production. Just think of this picture of delicious acid being spilled onto the luminal sidewalk as this kid here cowers away from the histamine bees. Now, this whole bee incident will surely affect this month's sales targets. Where did these bees come from? Was it sabotage by some rival stand? Oh, never mind. It looks like it might be due to those landscapers in the back. You see, the histamine that's activating the H2 receptors was initially released from enterochromaffin-like cells located in close proximity to the parietal cells. Let the unheeded sign of this bee-infested tree, enter carefully, remind you of the name of the enterochromaffin-like cell, unleashing its nesting histamine bees in response to all this unnecessary leaf blowing. But who watches the watchman? And by that I mean, who activates the activators? Well, in this case, gas or gastrin. Enterochromaffin-like cells have receptors for gastrin called the gastrin or CCKB receptors. When activated, the enterochromaffin-like cell releases histamine, much like how this gas-powered leaf blower triggers the release of all those histamine bees. But let's take it back one step further. Gastrin is initially released into the bloodstream by G cells. These cells are located in the antrum of the stomach, where they're stimulated by intraluminal peptides. In response, gastrin is released into the circulation, eventually passing into the submucosal tissue of the fundic glands, where it binds to those gastrin CCKB receptors on the enterochromaffin-like cells. G cells will be represented by this gas truck, of course, distributing its gastrin gas to landscapers all across the neighborhood. It turns out that besides activating the enterochromaffin-like cell, gastrin also directly binds to CCKB receptors on the parietal cells, stimulating the release of gastric acid. So we've drawn in a little propane gas tank attached to that acid-producing puree pump as well. In reality, however, gastrin's role here is minor. Gastrin's major effect on acid production is mediated indirectly through release of histamine from enterochromaffin-like cells. In contrast, acetylcholine is a potent direct activator of parietal cells. Stimulation of the vagus nerve leads to release of acetylcholine, which binds to M3 receptors right on those parietal cells, powering acid production. And yes, investing in a mobile lemonade stand allowed them to broaden their clientele base to the entire tri-state area. And yes, this time they've parked their motorcycle in the M3 parking spot, our recurring Sketchy symbol for activation of the M3 muscarinic receptor. Notice too that their motorcycle displays a little memento from their latest interstate sales promotion, here to represent direct stimulation of parietal cells by the vagus nerve. Not only that, vagal stimulation also indirectly promotes gastric acid secretion by activating those G cells to release gastrin. We usually think of the vagus nerve using acetylcholine, but here it's a little different. To activate G cells, the vagus nerve releases gastrin-releasing peptide, or GRP, represented here by our friendly gastrin delivery man pulling that gate release lever to get the gastrin flowing. So we've got the histamine Bs, the gastrin gas, and vagal acetylcholine all activating acid production at this parietal lemonade stand. Therefore, when trying to combat gastric acid, we've got a few options. How about blocking those histamine Bs from reaching that H2 receptor pot of honey? Our recurring symbol for histamine blockers is a bee swatter, of course. This time wielded in pairs to remind you that we're blocking H2 receptors here, not H1. The H2 receptor blockers include cimetidine, ranitidine, famotidine, and nizatidine. Notice that suffix, tidine. This is why we've dressed our young entrepreneur here in tie-dye. Think back again to those pathways we just discussed. H2 antagonists reduce the acid secretion normally stimulated by histamine, which came from the enterochromaffin-like cell. The enterochromaffin-like cell, of course, that was initially stimulated by gastrin from the G cell, which, if you recall, was stimulated by vagal action. So H2 blockers reduce the acid secretion normally stimulated by histamine, gastrin, and vagal stimulation. Remember though, vagal stimulation and gastrin also stimulate the parietal cell directly, so the inhibition of acid production is incomplete. Nevertheless, this means H2 antagonists are especially effective at inhibiting nocturnal secretion of acid, which depends largely on histamine. But they have only a modest impact on meal-stimulated acid secretion when the vagus nerve and gastrin are stimulating parietal cells in full force. Oh, here we go. Their first customer of the day. Looks like a lemonade connoisseur, gargling that sweet nectar in the back of the throat, sommelier style. Dry, slightly tannic aftertaste, with a modest burning, sort of esophageal sensation. The gargle represents gastroesophageal reflux disease, or GERD. Patients can take H2 blockers intermittently for infrequent heartburn or regularly for more frequent symptoms. However, if your GERD is associated with erosive esophagitis, it's best to block the proton pump directly. This can be accomplished with a proton pump inhibitor, which we'll introduce shortly. Notice that the sidewalk is sort of ulcerated, where our young lemonade snob is standing. Nocturnal acid suppression by H2 antagonists affords effective ulcer healing in most patients with uncomplicated gastric and duodenal ulcers, though proton pump inhibitors are first line. H2 antagonists are extremely safe drugs, and adverse effects are uncommon. One of the H2 blockers in particular, however, does have a few side effects worth mentioning, and that's cimetidine. To emphasize this, we'll have one of our tie-dyed employees sticking his hands in some wet cement on the sidewalk. Think cement sidewalk for cimetidine side effects. Check out this aggressive bee swatter here denting up the hood of that car to get the better bee swatting vantage point. Yep, cimetidine interferes with the cytochrome P450 system in the liver, as symbolized by this dented CYP450 license plate on the chrome bumper. Therefore, the half-lives of drugs metabolized by this pathway, such as warfarin, can be prolonged. Cimetidine doesn't only block H2 receptors. It also inhibits binding of dihydrotestosterone to androgen receptors, as well as inhibits the metabolism of estradiol. When used long-term or in high doses in men, cimetidine may cause gynecomastia, as depicted by this fearful lemonade stand operator with the 2 pitcher lids on his chest. These anti-androgenic effects can also lead to impotence, symbolized by this limp, floppy honey wand. Our adolescent businessman over here, of course, finds this whole situation hilarious. And as he laughs, milk flies out of his nose. High levels of milk production coming from the brain? Yep, it's our recurring symbol for elevated levels of serum prolactin, which can cause galactorrhea, another side effect of cimetidine. All right, amateur hour is over. These boys have had a nice run, but it's time to introduce the most famous young entrepreneurs of all time. The Girl Scouts, of course. Notice how she positions her cart of Girl Scout cookies directly in front of that puree pump, bringing a halt to that acid secretion. She depicts the action of proton pump inhibitors, or PPIs, and she's in it to win it. The grand prize, that is. The word prize should remind you of the suffix common to PPIs, presol, as in omeprazole, lansoprazole, and rabeprazole. Specifically, PPIs form a covalent disulfide bond with the hydrogen-potassium ATPase, irreversibly inactivating the enzyme. This lemonade stand has been shut down permanently. Think back to all those stimulants of acid production, since the proton pump is the final common pathway for hydrogen ion transport into the gastric lumen. PPIs will inhibit gastric acid secretion in response to all 3 major stimulants: histamine, gastrin, and vagal stimulation. Additionally, this means that PPIs are effective at blocking nighttime as well as meal-stimulated acid secretion. PPIs suppress gastric acid secretion to a greater extent than H2 receptor blockers. Gargling GERD, PPIs are the most effective agents for the treatment of non-erosive and erosive reflux disease. Ulcerated sidewalk, PPIs afford more rapid symptom relief and faster ulcer healing for duodenal ulcers and, to a lesser extent, gastric ulcers. PPIs are also preferred over H2 receptor blockers in the treatment of NSAID-induced ulcers. Whoa, easy there. Here comes our landscaper's even more eager associate on a high-powered mower. Notice, too, that his mower is attached to a jumbo-sized tank of gas. This represents a gastrin-secreting tumor, or gastrinoma, which overactivates the enterochromaffin-like cell to release more histamine, hence the extra swarm of bees. The excess gastrin will also overstimulate the parietal cell directly, remember. All this extra gastrin causes Zollinger-Ellison syndrome, which includes symptoms of abdominal pain, chronic diarrhea, heartburn, and even gastrointestinal bleeding. While H2 blockers are great at stopping those bees, they're not that great at stopping the direct effect of gastrin on the parietal cells, making PPIs the best medical treatment. I should have known. This is the propeller hat troop we're dealing with. known for their cutthroat entrepreneurial business strategies. These little Helicobacter helicopter hats emphasize the role of PPIs in the eradication of H. pylori infection. Recall from the H. pylori helicopter pilot Sketchy microsketch that 95% of patients with duodenal ulcers have H. pylori infection. Reducing peptic ulcer recurrence requires eradication of H. pylori with antibiotics and a PPI. This triple therapy includes a PPI, clarithromycin, and either amoxicillin or metronidazole. PPIs are also extremely safe drugs with minimal side effects, but there are just a few adverse effects to briefly mention. Behind the Girl Scouts' ruthlessly efficient marketing machine, there are a few flaws. Man, did they go all out this year. There's even a chocolate fondue fountain cookie dipping station attached to the wagon. Remember that spewing chocolate fountains and profusely flowing chocolate rivers are the recurring Sketchy symbol for Clostridium difficile, the bacterium that causes pseudomembranous colitis. Well, it turns out that gastric acid is an important barrier to the colonization and infection of GI tract by ingested bacteria. There is a 2 to 3-fold increased risk of hospital and community-acquired C. diff infection in patients taking PPIs. So I know it looks enticing, but I think I'll pass on the chocolate fondue. Ooh, and it looks like this Girl Scout here got a little too close and aspirated some of that flowing chocolate stream. Let her chocolatey lung spots remind you of the additional increased risk of both community-acquired respiratory infections and nosocomial pneumonia among patients taking PPIs. An acidic environment is also important for the absorption of food-bound materials, including non-heme iron, insoluble calcium salts, and magnesium. Therefore, the PPI-induced increase in the pH of the gastric lumen may reduce their absorption. On the side of the wagon, we've sketched in our recurring symbol for these 2+ cation metals, the iron, calcium, and magnesium metals, displayed here as the Scouts flaunt their past awards. Reduced calcium absorption can be particularly problematic in older adults. Calcium absorption is already decreased in these patients, and the prevalence of osteoporosis increases with advancing age. Long-term use of PPIs is even associated with increased risk of osteoporotic hip fractures, much like that fractured axle of their wagon that couldn't quite make it up that curb. Notice too that we've included our recurring symbol for osteoporosis, a porous, termite-ridden piece of wood, this time incorporated into the back of this dilapidated wagon. Patients on long-term PPIs should have monitoring of bone density and be given calcium supplements. You know, this is what happens when the wagon maintenance budget is siphoned into the fondue research and development budget. Come on, guys. This is like business 101. Decreased magnesium absorption may even lead to hypomagnesia. So let's sketch in our recurring symbol, falling M-shaped magnets, this time incorporated into the badges falling off of our pneumonia-ridden Scout as she coughs up that fondue. All right, before we wrap up this heated entrepreneurial rivalry, I want to mention one more signaling molecule produced endogenously that helps to shut off acid secretion: somatostatin. Think statin as in stopping acid production. Antral D cells are stimulated to release somatostatin by the rise in intraluminal H+ and CCK. Somatostatin then binds to receptors, represented by the stop signs, on the enterochromaffin-like cell and the G cell. Normally, somatostatin's job is to tone down gastrin production and the effects of gastrin. Well, it turns out that somatostatin receptors can also be expressed on gastrinomas. Yep, when PPIs are unable to control the excess gastric acid secretion, somatostatin analogs, such as octreotide, can help inhibit secretion of gastrin. Let the octagon shape of the stop sign specifically represent the somatostatin analog octreotide, binding to those receptors. Check out our Jack Stat and the Beanstalk sketch for more info on the types of hormone-secreting tumors treated with octreotide. All right, before this gets out of hand, let's sum up this sketch. First, I want to emphasize that these are H2 histamine receptors that are activating the parietal cell, not H1. H1 receptors mediate all those allergy and nausea symptoms that we discussed during the Midsummer Night's diphenhydramine sketch. H2 receptors, on the other hand, are located on the basolateral membrane of the parietal cells, where they stimulate acid secretion. H2 receptor blockers can be taken as needed for heartburn or as a daily regimen in patients with more frequent symptoms. These are those tidine drugs, hence the tie-dye shirts, such as cimetidine and ranitidine. However, it's not just histamine that's activating that acid-secreting lemonade stand of a parietal cell. Don't forget about direct gastrin stimulation, as depicted by the gas-powered puree pump, as well as the direct vagal activation via acetylcholine release onto muscarinic receptors, embodied in that Vegas-themed muscarinic motorcycle. Proton pump inhibitors inactivate the proton potassium ATPase. In other words, they block the final common step of all these pathways. So PPIs such as omeprazole, lansoprazole, and ribeprazole are often the more effective drug, especially when treating GERD, gastric ulcers, and duodenal ulcers. Remember those Helicobacter hats, because 95% of patients with duodenal ulcers have an H. pylori infection, and PPIs are an essential part of the triple therapy used to eradicate that GI-loving bug. PPIs are generally well tolerated. Rare side effects include increase of C. diff infection and pneumonia, probably because of increased colonization of the GI tract by ingested bacteria normally inactivated by acid production. Absorption of those cationic metals requires an acidic environment as well, so watch out for reduced calcium absorption, which can worsen osteoporosis. Just look at that fracture. Not good. Also, take a quick step back and look at all these pathways. Histamine B's from the enterochromaffin-like cells to the parietal cell, gas from the G cell to the enterochromaffin-like cell, and some more gas to the parietal cell, and vagus memories directly on the parietal cell and on the G cell. All these chemical messengers flying around. What in the... How did I not see this before? Looks like someone earned their first Young Saboteurs badge this morning. You win this year, Girl Scouts. Well played. Well played.